closer. But I don't guess. Yes, good. It's okay.
A very hearty good afternoon to everyone out there. We're live here right with you. So we are at SL Ranger Hospital, Mahim, which is a Fortis Associate. I, Dr. Sadia from Medical Oncology team, Clinical Associate to Dr. Shivam Shingla. I'm here for the discussion on the struggles of cancer patients and their mental health. Hi, sir. First, we have a little brief about a little introduction about Dr. Shivam. Dr. Shivam has a 12 plus experience in medical oncology and he's a consultant here at SL Raheja Hospital. Hello, sir. So, first, we start with if we may know what are the struggles that cancer patients they face today on a day to day basis when you meet them in your practice.
So, to all the listeners, many congratulations to you that you are hearing me today. I would be very honest to you. I was introduced into medical oncology from a perspective that I had a cancer patient in my family. And that day onwards, I've just realized one thing that doctors being doctors, patients have a different perspective towards the disease. They have their own struggles. Sometimes the struggles are financial, sometimes the struggles are mental, sometimes the struggles are related to the therapies that we give them. And there is a constant fear in them, more than anything. I feel all the patients are constantly in fear that is what is going to happen to them and what is going to happen to their family. One of the biggest struggle that I've always felt a cancer patient deals with is the fear that this cancer devastates their confidence in life. And whenever I try to approach in my practice for a cancer patient, and to you that you are hearing this from me, is that try to defeat cancer in the mind. I believe 90% of the patients they lose their battle in their mind. They would come to me, they would be confident, they would be going to shopping, watching movies, going out with friends, and they would be detected with breast cancer, probably even in stage 1. And the next day they will come to me and they say that their confidence in life is shattered. I say nothing is going to happen, you're going to be cured, but still they find it tough to come back from the fact that it's a life modifying disease. When I say life, I'm not saying about the number of years you live, it's just about the life in itself. So today I thought that I'd speak to you on how to fight these issues. If you are struggling, and you know, I'm sure everyone is, not only the patient but the relatives also struggle. Mental health in India is very under addressed, and I keep it a point that I keep telling patients that the first step towards a good mental health is acceptance. I think you have to be honest to your oncologist, you have to be honest to any person that you believe in. Sometimes people believe in God and they just speak that in front of God. It really helps. So, mental health as a struggle, the first thing you have to do is accept your problem. Try to approach a problem with a positive mindset. Whenever you are faced with a dilemma in life, whether you're going to do surgery or chemotherapy or radiotherapy, whether treatment is going to work or not, the first thing that you should tell yourself is that what are the two basic approaches to this problem? One of them is a positive approach and one of them is a negative approach. I will never be able to build this bridge. That's a negative approach. Even if I build this bridge, I may not be alive till the time it is opened up. It's a negative approach. The positive approach is today that a lot of people have been through this, have crossed this bridge before me, and I shall be one of them. If I am not able to cross this bridge, I will enjoy my life while going through this bridge. Maybe I'll enjoy the breeze, I'll enjoy the journey, and in turn, I will learn something, my family would learn something, or the doctor would learn something from me so that he can help more of his patients. So, yes, Sadia. Cancer patients have a lot of struggle. To your first question, I want to summarize that mental health is the biggest struggle that they face in day-to-day
Right.
practice.
The next question I would like to ask is, how do we help with the cost of the entire treatment? How do we manage that, the health?
See, one thing which you all have to realize is that with the advancement in treatments, the cost of the treatments are going up. When I talk about going up, in 2000, when my first encounter with cancer was year 2000, the cost of a breast cancer treatment was close to 50,000 to 1 lakh. And people were still struggling to go through the treatment at that time. Today, the average cost of a breast cancer treatment has gone up to 10 to 15 lakhs. Now, the first thing which people need to understand is that health insurance is very important. If you are looking for a good treatment and you don't want to compromise on your savings, get insured. All of you who are in their 30s, that is the right time to get insured because the peak incidence of cancer is between 50 to 60. And by that time, when that is a time when you have certain amount of savings and you don't want your savings to erode, getting insured as a family is very important. Second thing is there are options. You must always come forward, make a plan. You must decide a number which you will be able to afford throughout the cancer treatment. You can always discuss with your oncologist. There are discounts which you can avail on medicines. The surgeons are very understanding. They would help you with the billings. I have made a pledge that I don't say no to any cancer patient. So for me, the challenge is till the patient comes and opens up to me. There are a lot of organizations also which help you today to fight this disease. You have to come forward. And I'm very sure when a patient gets affected with cancer, any relative or any friends are very happy to help you. Don't ask them for an entire sum, ask them for a small donation. I'll give you a small example. There was a patient who had come to me and he was getting treated by my senior colleague, Dr. Suresh. He had come to meet us in the OPD and he sent a card inside. That card said that he owns a EV factory. They manufacture cars and bikes. So we were surprised. I mean, as a medical oncologist, who's coming to meet us with a card which says that I manufacture electronic vehicles. So this guy comes. He's a 30-year-old man and a young, smart man. He tells us, "Sir, I'm here to tell you thanks. Because of you, I could complete my treatment." And we were surprised. And he told the story. In the age of 6 years, he had developed blood cancer, and we wanted to do a transplant on him. He did not have any money. At that time, his parents were middle class, did not have any money. They could only manage 2 lakh rupees. The cost of transplant was 14 lakhs. But at that time, Dr. Advani had told him, "You start, money will come." So he said that, "Sir, I made that motto of my life. I started the transplant, money came, I finished my transplant. Now, when I approached my investors for this startup, I, I had little money. I put up this factory and I thought that if that line, you start and things will happen, worked in my disease, it will work in my business too." And today, he has got 3 factories and he manufactures these cars and scooters. So, yeah, start. Things will happen. And there are people like me, and there are many, many people like me who would be able to help you more and more as you move forward.
That was a beautiful insight. One a very important question that we see every day, especially when the patient is towards palliative, the end is near, and we see there's no treatment ahead. How do we actually deal that situation? How do we explain it to the relatives, to the patient? How would you do that?
I think in the world today, the challenge is expectation versus acceptance. And I keep telling this to the patients that the time has come to not have expectations from doctors, and time has come to have acceptance of the disease. I have not seen the richest of the people in the world survive age. Cancer is just an aging process which decays the body. So, at times, there are no options for treatment. But how to live without hope is the biggest challenge. So, what I do in my practice is then I tell patients that don't give up. There is science that I know which has no answer to your treatment, to your disease, but there are different science which have got a fantastic answer. Faith is one of those signs, and even if you're in the ocean, you're in the Indian Ocean, thousands of miles away, and you're there on a boat, a faith can take you to the shore. This is still a human task, so have faith. Sometimes people go on alternative medicines. Don't give up, and life is only about challenging yourself, understanding the gravity of the situation, and moving forward. So I would tell to everyone who's there, who's listening today, don't give up. Take opinion, speak to your oncologist, have a heart to heart with him, and go and move on to faith.
Have faith when others turn and run. Endure
Yeah.
the night there would be sun.
Yes, very rightly said.
So, what are the three things you would be telling the patients today for a better outcome?
I think one of the things which I already said is faith. I've had patients all the time who have had tremendous faith in me, more than that I have in myself, and they are doing well. They have beaten cancer right, left, center. Second is to have faith in themselves, and third is to have faith in medicine. The biggest problem today, which I face with cancer patients, is that people get upset on very small things. They will have one nausea, vomiting. They would say that I don't want this to. My phone internet is not working today. I will not come to the hospital. So as individuals, as human beings, we've lost faith in systems. And that is reflective in the society today. What's happening in Bangladesh, what has happened in Pakistan, what's happening in Sri Lanka, people have lost faith. And whenever there is loss of faith, the system goes down. So your body is like that system. So you need to run it through the faith. Have faith in your doctor, have faith in yourself, have faith in medicine. I keep telling all my patients that these are the medicines that are going to give you life. Don't even say that I don't want chemotherapy, I don't want immunotherapy. You should tell that give me as much as possible, but make sure that these medicines are the right ones so that they're able to work on me. And people who have the highest of faith in themselves, they have better outcome than individuals who don't. So faith, faith, faith is my simple answer to all of you.
So, as I see on everyday basis, when you counsel the patient, when you tell them take the medicines with a positive approach and don't call names when you're taking chemotherapy, that's where I get it.
Yeah, yeah,
That is the life saving drug.
that's very true, and that is there with everything. When you have athletes running for Olympics also, so they always go back to their faith, what motivated them to be there, and then they're able to give their best. So people who believe in themselves, they get the gold medals. People who lose faith, they don't have no motivation to run. Life is like that. Continue to have faith.
So, last but not the least, I would ask, what do you think? Do you really think cancer is at an increasing trend now? And what are the implications of it on the mental health of the patients who are already diagnosed and the ones who are newly diagnosed or towards palliation?
So, three parts to your question. Yes, cancer is on a steep climb. I don't think this is the peak. I believe by 2030, and there's a good data to back it, 1 out of 3 Indians will definitely have cancer, living Indians. In US, 50% of Americans get cancer, lifetime cancer. So I think we are just on the peak. In India, it would be at least 50% by 2035. 1 out of 2 living beings will have cancer. So yes, the worst time is ahead of us. The second part, mental health is deteriorating significantly. That's not only deteriorating for cancer patients, that is deteriorating for society as in general. People have had, people have lost their patience. Even when they come to the hospitals, they want to be in and out in 30 minutes as if it's a business meeting. I keep telling them when you come to the hospital, take time out for yourself. Don't be in a hurry. When you go to temple, you stand in line, you endure, and that is what is good for your mental health. Similarly, when you come to hospital, have time and patience. So mental health has gone down on that regard. Third, with the availability of the social media, a lot of negativity is easily available, and individuals are very prone to attract negativity in general. It is very difficult to uh, go away from negativity. It's very difficult for me to pull people towards a positivity in general. So that is one of the biggest challenge that I face today because of the social media. People would read something, don't eat this, don't eat that, and then they would be caught up in that mindset, and they would say that they tend to catch negative things easier. So sometimes I believe that we as physicians also become we try to sell fear so that because the patient takes it easy. But I think it's a wrong approach. The approach should only be faith and positivity.
Faith on
Men,
the doctor.
faith on the doctor and faith on yourself and patience. Mental health of relatives is significantly affected for any cancer patient, and that's a very under addressed issue right now. I think a lot of people undergo mental trauma, stress, even after the patients they get cured. They continue to remain in fear of an impending cancer. I have patients, relatives that's come to me for regular checks and everything has been okay. They would have simple fever and they would be worried that this could be a symptom of cancer. They live in fear. So, yes, as a nation, we need to address mental health. And I believe, as any disease may be, cancer patients are very vulnerable to a poor mental health. So, today I thought I would speak to you about mental health, and I hope you've got a good insight. If there are any questions, please post them into the chat box. I would be very keen to sort of answer them. But my simple advice would be do your yoga, run, exercise, beat cancer in the head. Rest will take care.
So just one more question I would like to ask. So we talked about the mental health of the patients. What about the relatives? How do they beat it? What do they do about it? Because they are the ones dealing with the patients 24/7 in the hospital
So I'll
outside.
tell you very honestly, my take on this is pretty simple. I believe a healthy pond is where the healthy fishes live. So I've scolded relatives many times because people would talk about negative things in front of a patient, and then my onus it's on me to push them towards a positivity and all those things, and I've scolded relatives significant number of times that if you don't create a healthy environment around this patient, how am I going to pull him out of the misery? So I think for relatives, the most important aspect is that this need to be they need to stop being in the driver's seat. The problem is there's only one passenger and there are more than 10 drivers. I think the patient should drive the treatment. The patient should drive the positivity. The role of the relatives in dealing with a cancer patient is just to motivate him, try to bring him towards a normal life, take him out for movies, take him out for dinners, go out for vacations, plan plan so that every subconscious cell of that patient believes that everything is normal. Uh, problem starts when they start behaving in the driver's seat and they start thinking that this intervention is going to help, but that intervention is going to help. I think that is what deteriorates and it makes a patient more patient. So I would say that have patience, have faith, and always bring a positivity, calmness when you are dealing with the physician, when you are getting the patient to the hospital. Try to bring positivity and calmness. The amount of positivity that you see when you go to a temple or a mosque or a church, that is the amount of positivity that you should have once the patient visits the hospital. And you yourself are responsible for this. The better you create that pond, the better that fish is going to do, and the failure is as much as mine as is yours. So try to create a positive environment.
So the way you always say, out of sight, out of mind, like when the once they are out of the hospital, you need to forget about the hospital
Yeah.
treatment, cancer, everything, and
That's the way life
continue with the
moves
normal
on.
life at home.
That's the way life moves on. When the kid is out of the school, no need to think about it. When the exam is gone, it's gone. You can't go back and do anything about it. When the chemotherapy is done, you got 2 weeks, 3 weeks. Don't think
Forget
about
about
it.
cancer.
So yeah, thank you so much. I see no questions, and thank you, Sadia, for that being
That
one
was
of
a
yours.
beautiful insight, sir. Thank you so much for
Thank
connecting with
you,
us.
and
Any queries, please feel free to contact us.
thank you to all of you for being patient hearing. And with this, I would like to take your leave and would end this conversation. You can always reach out to me. You know where I work, and I'm always available for you. Have a
Thank
great
you.
day.
Thank you, sir.